So Texas Radiology Associates is a 155-man group based out of Plano, Texas. They've been in existence since the early 1970s. Very fast-growing group. They started off with 1 or 2 hospitals, and today they're in about 40 different hospitals. They read for hospitals and clinics throughout the Dallas Metroplex. And just to put this in perspective, they were a group which has been very, very successful, but they themselves were in a state of influx, trying to figure out what do they do to continue the practice of radiology. They've spoken to every private equity group out there. They've spoken to all the consolidators, and they even went on a speed dating with venture capitalists to try and explore all the different opportunities out there. The reality was they did not want to sell their practices, and every alternative out there required them to sell their practices. They wanted to continue the legacy that the founders of Texas Radiology had created, but they realized that there were some big obstacles that they had to overcome. One of which was technology, the second of which was enhancements and improvements on the revenue cycle side, and the third was nighttime coverage in addition to subspecialty reads. So with all these factors in mind, they looked to see what are the other alternatives out there, and when they realized there were no other alternatives, they came out with a requirement from all the partners that they wanted to do something which would enable them to maintain their autonomy and independence, would allow for the continuity of their practice, and would make sure that they're delivering additional value back to their hospital system. They had approached the idea of collaborative imaging very early on in 2018, and they realized that collaborative imaging could provide them with the tools and the technology that they needed to be successful and viable for the long haul. Today, if you look back at what we've accomplished for Texas Radiology, it's pretty amazing to see that, number one, we've improved their revenue by over 25% on the same book of business. What that basically means is Texas Radiology as a group was leaving 25% of their revenue on the table. In addition to that, we've also improved their cost of operating their business by reducing the cost by 30%. In our model, the way we have set up collaborative imaging, almost all of those savings and all of that benefit goes back to the physicians. So what that means is that physicians today are earning a lot more money than they were the day before they joined collaborative imaging. In addition to that, the physicians are much more satisfied. They're happier with their jobs. They're happier with the quality of their life, and they're happier delivering care, which results in more effective, more efficient patient care being delivered, as well as physicians who are willing to be more integrated into their hospital systems and healthcare systems. So it's truly a success story. We've done a phenomenal job. Some of our best ambassadors, if you will, are members of Texas Radiology. They're truly an amazing group to work with, and we're very excited with the partnership that we have with them.